It's a Northwest lifestyle weekend on Como News. Now back to IRG's Health Talk.
Dr. Lisa DePietto is our next guest as we bring you our IRG Physical and Hand Therapy Health Talk. Owner of Town Center Eye Care and a physician talking about her practice and tips for sustaining good vision as you age. I think that's something we could all take a cue from, Shannon.
Yeah, it wasn't about 12 years ago for me, 14 years ago, all of a sudden I noticed I was having difficulty reading the newspaper, and I was like, what's going on here? All of a sudden I needed bifocals, so I went and saw an optometrist, and that's what Dr. Lisa is going to talk about today is eye care as we age, the need for continued examinations, and what she can do for you.
Here's that conversation with Shannon and Dr. DePietto.
Dr. Lisa DePietto, how are you?
I'm well, thanks, Shannon. How are you doing today?
Doing fantastic. Hey, you're an optometrist. Why don't you tell us and our listeners about your business and about your background? Why optometry?
Well, optometry was something I thought of back in high school. I knew I wanted to help people, and to be honest, I didn't know if I wanted to look at teeth or feet or eyes all day, and eyes won out.
Eyes went out. What, eyes are so complicated. Why the interest in eyes? It's so much physics and it's so much math, and you look at what the eyeball does and how it refracts and reflects, and man, it's complicated. Tell us about that.
Absolutely. Well, the eye has over 300 parts to it, and when I see a child, I always try to teach him another part. Everybody usually knows the pupil. And I loved biology in college, so I studied biology with a passion, and it's kind of cool to know about all the parts of the eye. And then I grew up in New York City, Queens, and I went to school in Philadelphia to the Pennsylvania College of Optometry. That's a 5-year program after college, so I earned a doctorate in optometry. And I just followed my passion. It was something that I wanted to be in the medical field, help people, and look after their eye health, as well as, really know how to refract their eyes so they get a good pair of glasses that they can, or contact lenses they can see well out of.
And so for some of our listeners, I'm sure they know this, but again, just to review, tell us the difference between optometrist versus an ophthalmologist. Just kind of talk about that a little bit and kind of how you work together and collaborate.
Sure. We do have a good symbiotic relationship. The ophthalmologist goes to medical school, and then they have to do postgraduate work for 3 years to study ophthalmology. And they're typically the surgeons, or they treat different various eye diseases. An optometrist needs a full a bachelor's degree, a college degree, and then they go to optometry school and can complete that anywhere from 4 to 5 years. And we also get a doctorate. We don't do surgery except in some parts of the country where it's rural and people cannot get to an ophthalmologist. But the relationship we have with one another is a mutual respect, because there are things that I will diagnose. I am trained in the treatment, management, and diagnosis of eye disease. And if I see something like let's say an older person who needs cataract surgery, I will refer to my cataract surgery center where their ophthalmologists are doing cataract surgery. That's an example.
Yeah. So you're looking at the eye from a standpoint of vision and blood flow, pressures. When you go see, I've seen you. You're fantastic.
Mm-hmm.
Your patient care, your customer service. It must be that New York in you. I don't know, but it is fun to go see you. And you look at everything. What are you looking at? Pressures, blood flow. You're looking for all those diseases. And then we're going to get into the health of the eyeball. Tell us about the exam process.
Yeah, the exam, I take a good history to see what the purpose of a patient is there for, and you can learn a lot from the eye. You look into someone's pupil, and it's basically a window into an area that's you can see blood vessels. You can't see the blood flow, but we have ways to measure that. But the appearance of our blood vessels in the back of the eye can tell a tale of if someone has cardiovascular disease, high blood pressure, if they're diabetic. Unfortunately, diabetes is the number one cause of blindness in the United States. And there's a condition called glaucoma, which is a high pressure in the eye. And I do a test where we check the pressure in one's eye. So several things are really shown throughout the whole body when we look into one's eye. It's pretty cool.
More with Dr. Lisa DePietto and Shannon O'Kelley next on Como.
It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
We're talking about good vision. Here's Dr. Lisa DePietto and Shannon O'Kelley.
Dr. Lisa DePietto, thank you for joining us. Optometrist, Mill Creek Eye Center, or I guess it's Town Center. Is it in Mill Creek, the Mill Creek Town Center, right?
Correct. It's called Town Center Eye Care, just like the easy to remember. We were going to call it Bella Vista, but that was a little bit beyond. Everyone said to me for a year, are you going to be in the new town center? So that became the name.
You know, I mean, the eye is amazing. It's an amazing organ. You were talking about glaucoma. You're talking about cataracts, diabetes. I mean, circulation is so important. People need to understand if your tissue and your retina is a bunch of cells, if that retina or that optic nerve is not getting a blood supply, which can happen with pressure changes or unhealthy situations, high blood pressure, diabetes, that tissue dies. It doesn't replace itself. And if that optic nerve dies, it's not sending that message from the retina to your brain, and you lose vision. That's what happens. I mean, how can we keep our eyeballs healthy in our day-to-day lifestyles? I guess I want to know, I want to see the rest of my life, right? I mean, it's so important. How do I continue to keep my eyes healthy?
Absolutely. Thinking about your eyes is very important. Don't take it for granted.
No doubt.
Routine eye exam is important. The American Medical Association recommends those every 2 years if you're below the age of 60, and yearly after 60 years of age, just because maybe things tend to happen more when we're older. And, I always tell people nothing I do in here is going to hurt, and it's all straightforward. I explain everything as we go along. Just a simple way to safeguard your vision for the rest of your life. And even if you don't have symptoms, it's important to come get routine eye care. And nowadays, too, it's really important with all the screens that we look at, and especially the past year that young people, I'm diagnosing a lot more young people having difficulty at the computer, and it's not always a blue light blocker you need. There's digital eye strain, computer eye strain, whatever you want to call it. But I'm also here to diagnose those things.
Talking about young kids, what is the age you recommend that parents keep an eye out for maybe some visual problems as kids are learning?
Definitely, we recommend exams. You usually examine as an infant in the hospital for your health of your eye, and then they say at 3 years of age, and definitely by school age. Sometimes if you wait until a child is 12, 14 years of age, children don't always know. When we get a pair of glasses, we didn't realize there were leaves on that tree. It looked like a big green blob. So children always don't, right? They don't know how to articulate that they cannot see. Children are mislabeled ADD or ADHD because they can't sit and read. And sometimes they see fantastic far away. They're farsighted, but they struggle with up close. So all those things are a good reason to make, just like when your first tooth pops and you go to Buffalo Square Dental, you want to come to me if your child is young and school age, so I can help them along and see if they have any undiagnosed refractive error or need for glasses.
Wow. Dr. Lisa DePietto, Town Center Eye Care. Give her a call. She'll take care of your eyes. Thank you for your time. Thank you for information.
Thank you so much for this opportunity, Shannon. I appreciate it.
You've been listening to Dr. Lisa DePietto. More information at towncentereyecare.com. And Shannon, that's a great thing for us as we get older to know about. It's also a great thing for parents, grandparents to be concerned about with their kids, making sure their vision is good.
Yeah, you should have your eyes checked on a regular basis. I mean, you may or may not know this, Tom, but like if your pressure changes in your eye, that can lead to some problems, right? So it's all those things that happen. Eye is very, very complex.
Final segment right after this timeout on Como.